Hello, my name is Haley Hartley, and this is a presentation on supportive care for breastfeeding mothers. So, for supportive care for breastfeeding mothers, what are the benefits of breastfeeding? Why do some women choose to not breastfeed? And as a nurse, what can I do to aid women in meeting their breastfeeding goals? These are the objectives that we'll cover during this presentation. So, why support breastfeeding? Well, for the infant, it promotes attachment and bonding between mother and baby. Having that skin-to-skin time, especially during the transition period, is so good for baby, helping them hold temperature, learn their environment, and really just gain trust for the people around them. Breast milk is full of the nutrients and antibodies that baby needs. There's no need to add any extra to it. Baby's going to get what they need with this natural substance. Breast milk is easier to digest. Babies' tummies are made to digest breast milk because it is a natural product. Okay, so that means less gas, less fussiness, less diarrhea. Okay, breast milk is always the right amount. Babies' tummies at birth are about the size of a hazelnut, approximately 1 to 2 teaspoons. Within the first week, they'll gain the size to about a walnut, which is about 2 ounces. So breast milk being the right amount, you don't have to worry so much about overfeeding. This reduces the risk for reflux, aspiration, and respiratory infections due to the aspiration. Breast milk decreases the risk of necrotizing enterocolitis, again, lower respiratory infections, asthma, obesity, and type 2 diabetes. Infants who are breastfed also often have fewer incidents of earaches, probably because of the antibodies that they're getting from mom. So for mother, the benefits of breastfeeding. We have skin-to-skin bonding again. This releases oxytocin for mom. Okay, with the release of oxytocin, it helps mom to relax, become in a calmer state, and really just enjoy having baby there. It helps with uterine devolution. Get the uterus back down to normal size. Clamp off any bleeding. Help her get back to regular routine faster. It prevents postpartum depression, type 2 diabetes, breast cancer, and certain types of ovarian cancer. Breastfeeding for mom can prevent obesity later in life, achieve pre-birth weight sooner. With breastfeeding, there's no need for sterilization, no need for extra supplies, extra nipples. Everything mom needs, she came with. So this is incredibly cost saving. Okay, it's economical and environmentally safe. We don't have a lot of extra waste. So why do some women choose not to breastfeed when there's so many obvious benefits? Well, a lot of women fear it. Okay, in my practice, I hear moms saying, I'm doing it wrong. I'm afraid baby's not getting enough to eat. I think baby doesn't like breastfeeding. And it's like, well, baby doesn't know if they like it or not. Okay, so what we need to do is educate moms. Let them know that they are feeding baby enough. The best way to do this is to monitor diapers. Okay, day 2, we'll have 2 wet diapers, 3 stools. By day 3, we should have 5 to 6 wet diapers and 3 stools. So we're going to monitor this. We're going to watch for signs of dehydration, signs of hypoglycemia, the jitteriness, not holding temperatures, lethargy. We're going to monitor for jaundice. At 24 hours, we do a bilirubin. Okay, All of these are ways to make sure baby is getting enough food. Um, Also reinforce if baby's fussy, eats, and then goes to sleep, they're satisfied. They feel full and mom has done a good job. Okay. So other reasons beyond the psychological are social. We live in a busy society. Women have the need to go back to work now. They may not have enough maternity leave from their job, or they may just have to go back to get that extra income. Now there's a baby to support. So, 2/3 of women working today work 35 hours a week, according to the U.S. Department of Health and Human Services in 2011. So this is a big thing for women. How do you breastfeed when you go to work? Do you have somewhere that you can go and pump? Do you have a clean, private environment that would let you even bring baby in to breastfeed? You know, and then also there's social stigmas. The breast is viewed as a sexual stimulus for women, and women are made to feel ashamed to expose the breast. The best way to combat this, again, is education. We need to educate mothers, we need to educate families, we need to educate the rest of the society. Breastfeeding is normal, it's natural, and it's the best way. Okay? So, more on supportive care. The World Health Organization recommends infants be breastfed exclusively for the first 6 months of life. After 6 months, you can start introducing the more solid foods. But for the first 6 months, breastfeeding is the best feeding. According to the U.S. Department of Health and Human Services, of infants born in 2007, only 75% were breastfed. By 6 months, only 13% were exclusively breastfed. So, how, as a nurse, do I improve these numbers? How do I get out there the importance of breastfeeding? Well, be educated. Be up to date on techniques and studies. Spread the knowledge, okay? The best way to do this, lead, participate in, promote support groups. Encourage moms to find support groups on their own. Great places to go are womenshealth.org and La Leche League. These are great sites to help women um, find support groups in their areas, find education about breastfeeding, and kind of find just different things that they may, what other women are having issues with that they're having issues with. A good way to communicate among women. Another, begin breastfeeding education early. Begin it in the office. Begin it in prenatal classes, baby basic classes. Okay, that's where we need to really drive home benefits of breastfeeding, ways to breastfeed, what to expect when you start this process. A lot of women think, oh, it's breastfeeding, baby will know exactly what to do. They don't. It's a learning process for mom and baby. Let them know that. Encourage father of baby, significant other, grandparent, whoever wants to participate in the breastfeeding, encourage them to be in these classes too, to get the education. Let them be a part of it. And this creates a support network for mom when she goes home. Most of these moms get 24 or 48 hours in the hospital. All we can do is help them while they're there. So we need support networks for mom when she goes home. Build those in the prenatal period. And while mom is with you in the hospital, while she's there in the classes, point out what she's doing right. Make sure to encourage her. Let her know when she makes positive progress and that she can do it when she goes home. Okay? This has been my presentation on supportive care for breastfeeding. I hope that we have all learned a lot and that you will continue to encourage and educate mothers on the importance of breastfeeding. Thank you and have a nice day.